Welcome back. Today we are talking about hemorrhoids, also called piles. And by the end of this video, you will understand what hemorrhoids are, why they happen, what symptoms they cause, what the warning signs are, what you should eat, what you should avoid, which home treatments actually help, which medicines are commonly used, which daycare procedures are available, when surgery is needed, what doctors mean by stages or grades of hemorrhoids, and how treatment planning changes if a patient also has diabetes or high blood pressure. Let's start from the beginning in the simplest way possible. Hemorrhoids are swollen vascular cushions in and around the anus and lower rectum. These cushions are actually a normal part of the body, but when they become enlarged, inflamed, prolapsed, irritated, painful, or start bleeding, that is when people say they have hemorrhoids or piles. So hemorrhoids are not some rare disease, they are extremely common and many people experience them at some point in life. There are two main types of hemorrhoids. Internal hemorrhoids are inside the rectum or anal canal. External hemorrhoids are under the skin around the anus. This difference matters because the symptoms are often different. Internal hemorrhoids commonly cause painless bleeding, especially during or after passing stool. They can also prolapse, which means they may come out during straining. External hemorrhoids are more likely to cause pain, swelling, irritation, itching, and a tender lump near the anus. If a clot forms in an external hemorrhoid, that is called a thrombosed external hemorrhoid, and that can become very painful very quickly. A lot of people ask, what is the difference between piles and hemorrhoids? The answer is simple. They are basically the same thing. In many countries, people use the word piles, and in medical language, the word hemorrhoids is used more often. So if you search piles symptoms, hemorrhoid treatment, hemorrhoids treatment, you are usually talking about the same condition. Now, let's talk about why hemorrhoids happen. Hemorrhoids usually develop because of repeated pressure in the lower rectum and anal area. Anything that increases strain, pressure, or friction in that area can contribute. The most common cause is constipation and straining during bowel movements. When someone has hard stool, sits on the toilet for a long time, pushes hard again and again, and does this repeatedly over weeks or months, pressure builds up in the hemorrhoidal veins and tissue. Over time, those cushions enlarge and become symptomatic. Low-fiber diet is another major factor. If your diet is low in fruits, vegetables, whole grains, beans, lentils, and other fiber-rich foods, your stool is more likely to become hard and difficult to pass. If you are not drinking enough water, that can make constipation worse. Pregnancy is another very common cause because of increased pressure in the pelvic area and hormonal changes that can contribute to constipation. Obesity can also play a role. Long periods of sitting, chronic diarrhea in some people, aging, and repeated straining are all part of the bigger picture. So if you want the simplest answer to what causes hemorrhoids, here it is. Hemorrhoids happen when bowel habits and pressure patterns keep irritating and overloading the hemorrhoidal tissue. Now let's move to symptoms, because this is where many people get confused. Internal hemorrhoids often cause bright red bleeding. A person may notice blood on toilet paper, blood dripping into the toilet, or blood on the outside of the stool. Internal hemorrhoids may also prolapse. At first, they may come out only during straining and go back in by themselves. Later, they may need to be pushed back in manually. In more advanced cases, they may stay outside. Some people with internal hemorrhoids also feel pressure, discomfort, mucus discharge, or the sensation that something is bulging or not emptying properly. External hemorrhoids often cause itching, burning, irritation, pain while sitting, discomfort during cleaning, and swelling around the anus. Some people feel a soft or tender lump. If it becomes thrombosed, pain can suddenly become severe. The lump may become hard, tense, swollen, and very tender. Now here is an important point that many people do not know. Not all anal pain is due to hemorrhoids, and not all rectal bleeding is due to hemorrhoids. Anal fissure, abscess, fistula, inflammatory bowel disease, polyps, and colorectal cancer can also cause bleeding or pain. That is why persistent bleeding should never be ignored. Let me say this very clearly. If someone has repeated rectal bleeding, especially if it is new, heavy, unexplained, associated with weight loss, black stools, fever, dizziness, weakness, or severe pain, that person should get proper medical evaluation. Hemorrhoids are common, but they should never be used as an excuse to ignore serious symptoms. Now let's talk about the warning signs that need medical attention sooner rather than later. If you have a painful lump that appears suddenly, that may be a thrombosed external hemorrhoid. If you have severe pain that does not improve, if you cannot sit, if bleeding is significant, if you feel faint, if stool is black, if you have fever, or if the symptoms do not improve with simple home care, you should see a doctor. If the bleeding is persistent, or you are older, or you have a family history of bowel disease or colon cancer, proper evaluation becomes even more important. Now let's talk about how doctors diagnose hemorrhoids. Diagnosis begins with history and physical examination. The doctor will ask about bleeding, pain, bowel habits, constipation, straining, prolapse, itching, and any red flag symptoms. External hemorrhoids can often be seen during examination. Internal hemorrhoids may require a digital rectal examination and sometimes a scope-based exam of the anal canal or lower rectum. In some cases, further tests may be needed depending on the age of the patient, the pattern of bleeding, and whether there are warning signs pointing towards something more serious. Now it is time to understand grading because many people hear the terms grade 1, grade 2, grade 3, and grade 4 hemorrhoids and do not know what they mean. Grade 1 hemorrhoids bleed but do not prolapse outside. Grade 2 hemorrhoids prolapse during straining but go back in on their own. Grade 3 hemorrhoids prolapse and need to be pushed back in manually. Grade 4 hemorrhoids are prolapsed and cannot be pushed back in. This grading system applies mainly to internal hemorrhoids, and it helps doctors decide which treatment is most suitable. Now let's come to one of the most important parts of this entire topic: diet and bowel habits. This is where a lot of people go wrong. They search for the best cream, the best ointment, the best medicine, the best surgery, but they ignore the root problem. If constipation, hard stool, dehydration, low fiber intake, and straining continue, hemorrhoids often keep coming back. So what should you eat if you have hemorrhoids? You should eat foods that help create softer, bulkier, easier to pass stool. That means fruits, vegetables, oats, bran, legumes, lentils, beans, whole grains, and other high-fiber foods. Fiber is one of the most important parts of hemorrhoid treatment because it reduces straining and improves bowel movement quality. Water is equally important. If fiber is increased without enough fluids, stool can still remain difficult to pass, so hydration matters. A lot of people ask about psyllium husk or fiber supplements. Yes, fiber supplements are often used when someone cannot get enough fiber from food alone. They can help, but ideally they should be combined with water and with gradual dietary improvement. If someone suddenly starts very high fiber without adjustment, gas and bloating can happen, so gradual increase is usually better. Now, what should you avoid? Avoid chronic constipation. Avoid dehydration. Avoid delaying bowel movements again and again. Avoid sitting on the toilet for a long time scrolling on your phone. Avoid repeated straining. Avoid excessive rubbing or harsh wiping. Avoid a daily routine that keeps your stool hard and your bowel habit unhealthy. A lot of people ask about spicy food. Spicy food is not the main medical cause of hemorrhoids, but some people do feel increased irritation with very spicy meals. The stronger, more important issue is whether your overall diet is causing constipation or irritation. Now let's talk about home treatment, because this is what many people search first. And to be honest, many people do get relief from proper self-care, especially in mild or early hemorrhoids. One of the simplest home treatments is the warm Sitz bath. This means sitting in warm water for a short period to help reduce discomfort, irritation, and spasm. It does not remove advanced hemorrhoids, and it does not cure every case, but it can help symptoms. Another important home step is correcting constipation with fiber, water, and bowel habit changes. This is not glamorous, but it is one of the most effective things you can do. Cold packs or wrapped ice packs may help reduce swelling and discomfort for some people. Gentle cleaning is important. Aggressive wiping, perfumed wipes, or harsh rubbing can make symptoms worse. Some people get relief from over-the-counter creams, ointments, pads, or suppositories. Products that contain soothing agents, witch hazel, local anesthetic ingredients, or short-term hydrocortisone may reduce itching or inflammation temporarily. But this is very important. Creams usually relieve symptoms. They do not fix the root cause. and some steroid-based products should not be used for too long without medical advice. More fiber, more fluids, less straining, improved bowel habits, warm water soaking, and short-term symptom relief with appropriate topical products. Now let's talk about medicines. If the main problem is itching or irritation, topical products may help. If the main problem is pain, pain relief measures may help. If the main problem is hard stool and constipation, then stool softening and fiber improvement are critical. Many people ask, what is the best medicine for piles? The answer depends on what symptom you are trying to treat. If the main problem is itching or irritation, topical products may help. If the main problem is pain, pain relief measures may help. If the main problem is hard stool and constipation, then stool softening and fiber improvement are critical. If the main problem is advanced prolapse or repeated bleeding, medicine alone may not solve it. In routine care, medicines and products commonly discussed include creams, ointments, suppositories, pain relievers, topical anti-inflammatory agents, and constipation treatment when needed. But again, if the bowel pattern remains unhealthy, symptoms tend to return. Now let's move to the next level of treatment. What happens when home care is not enough? If hemorrhoids are repeatedly bleeding, if symptoms keep coming back, if prolapse is progressing, or if daily life is being affected, doctors often consider office-based or daycare procedures. These are especially used for internal hemorrhoids. Many people are afraid when they hear the word procedure, but not every procedure means major surgery. One of the most common office procedures is rubber band ligation, also called hemorrhoid banding. In this procedure, a small band is placed at the base of the internal hemorrhoid. This cuts off blood supply to the tissue, which then shrinks and scars down. Banding is often used for symptomatic internal hemorrhoids, especially lower grades and selected grade 3 cases. It is usually done as an outpatient or office treatment. Some people feel pressure or discomfort afterward. Mild bleeding may happen later. Sometimes more than one session is needed. Another office procedure is sclerotherapy. In this method, a solution is injected into the hemorrhoid to make it shrink. This is another option, particularly for bleeding internal hemorrhoids. Infrared coagulation is also used. In that technique, heat or infrared energy is applied to create scarring and reduce hemorrhoidal tissue. These procedures are often chosen when conservative treatment has failed, but the disease is not yet at the level where full surgery is clearly needed. Now let's talk about surgery, because this is what people often fear the most. Surgery is not needed for every hemorrhoid. Many cases improve with diet, home care, and office procedures. Surgery is more often considered when hemorrhoids are large, prolapsed, recurrent, advanced, mixed internal and external, or causing major symptoms despite other treatment. Grade 4 hemorrhoids are much more likely to need surgery. Large symptomatic external hemorrhoids may also require surgical treatment. Some grade 3 cases can go either way depending on symptom severity, anatomy, patient preference, and response to previous treatment. The classic operation is hemorrhoidectomy, which means surgically removing hemorrhoidal tissue. It is one of the most definitive treatments, especially for advanced or external disease, but it can involve more post-operative pain than office procedures. There are also other operations or procedural surgeries such as stapled hemorrhoidopexy and hemorrhoidal artery ligation or dearterialization in selected cases. The best option depends on the type of hemorrhoids, whether they are internal or external, whether they are prolapsed, how severe the symptoms are, and what the surgeon finds on examination. A very important special case is the thrombosed external hemorrhoid. If someone develops sudden severe pain and a hard tender lump and they are seen early, a doctor may consider removing the clot. This can provide significant relief in selected cases. Timing matters, which is why sudden severe anal pain should not simply be ignored or self-treated for days without assessment. Now let's connect treatment to grade in a very practical way. If someone has grade 1 hemorrhoids, treatment often begins with fiber, fluids, constipation correction, better toilet habits, and symptom control. If bleeding persists, office procedures may be considered. If someone has grade 2 hemorrhoids, conservative care is still important, but if symptoms continue, banding, sclerotherapy, or infrared coagulation may be used. If someone has grade 3 hemorrhoids, Some can still be treated with office procedures, especially banding, but recurrence may be higher and surgery becomes a stronger consideration. If someone has grade 4 hemorrhoids, especially if they are prolapsed and cannot be reduced, surgery is much more likely to be the appropriate treatment. Now let's talk about pregnancy, because this is a very common situation. Pregnancy-related hemorrhoids happen because of increased pressure in the pelvic veins, hormonal changes, and constipation. Many pregnant patients develop piles during pregnancy or after delivery. The focus in pregnancy is usually on safe symptom relief, bowel habit improvement, fiber, water, stool softening measures, and avoiding strain. Many cases improve after childbirth, but not all do. If symptoms persist, treatment after delivery may still be needed. Now let's talk about diabetes because you specifically wanted this point covered well. If a patient has diabetes and also has hemorrhoids, the hemorrhoids themselves are not necessarily a different disease, but procedural planning becomes more important. Blood sugar control matters around procedures and surgery because poor glucose control can affect healing and increase the risk of complications. So if a diabetic patient needs a hemorrhoid procedure or surgery, doctors think about how well diabetes is controlled, whether medication adjustments are needed, how fasting will be managed, and how blood sugar will be monitored around the procedure. The main message is simple. If you are diabetic, do not think of piles surgery as just a casual quick fix. Blood sugar control should be part of the treatment planning. Now let's discuss high blood pressure. If someone has uncontrolled hypertension and needs elective hemorrhoid surgery, the medical team may want the blood pressure optimized first. This is because severely elevated blood pressure can increase perioperative risk. Many blood pressure medicines are continued, but exact medication planning depends on the case and the anesthesia team. So again, the message is simple. If you have hemorrhoids and need a procedure, and you also have high blood pressure, your blood pressure should be reviewed and controlled properly before elective surgery. Now let's move into prevention, because preventing recurrence is one of the smartest parts of hemorrhoid care. Many people think once symptoms settle, the problem is solved, but hemorrhoids often come back if the lifestyle does not change. Prevention is not mysterious. It is mostly about bowel discipline and reducing mechanical stress. Eat enough fiber, drink enough water, stay active. Do not sit on the toilet for a long time. Do not strain. Do not ignore the urge to pass stool. Avoid repeated constipation. Clean gently. If you spend all day sitting, movement and bowel regularity matter even more. Let's also clear up a few myths. The first myth is that all rectal bleeding is hemorrhoids. That is false. Persistent or unexplained bleeding needs medical evaluation. The second myth is that creams permanently cure hemorrhoids. That is false. Creams can help symptoms, but they do not fix constipation, poor bowel habits, or advanced prolapse. The third myth is that every hemorrhoid needs surgery. That is also false. Many patients improve with conservative treatment, and many internal hemorrhoids can be treated with office procedures before surgery is considered. The fourth myth is that pain always means internal hemorrhoids. Not true. Internal hemorrhoids often bleed without pain. Significant pain makes doctors think about external hemorrhoids, thrombosis, fissure, or other anorectal problems. Now, let me give you a very practical summary. If your hemorrhoids are mild, start with fiber, fluids, better toilet habits, less straining, warm water soaking, and appropriate short-term symptom relief. If you keep bleeding, if the hemorrhoids keep coming out, if symptoms return again and again, or if your quality of life is being affected, see a doctor because office procedures may help. If you have severe pain, a sudden hard lump, or significant bleeding, get checked sooner because a thrombosed hemorrhoid or another diagnosis may be present. If the hemorrhoids are advanced, large, prolapsed, or mixed internal and external, surgery may be the best option. If you have diabetes or uncontrolled blood pressure, those conditions should be part of the planning before any elective procedure. And the biggest long-term lesson is this: hemorrhoid treatment is not only about removing symptoms, it is about correcting the bowel habits and pressure patterns that created the problem in the first place. So whenever someone asks, what is the best treatment for hemorrhoids? The real answer is this: the best treatment depends on the type of hemorrhoids, the severity, the symptoms, whether there is bleeding or prolapse, whether the case is internal or external, whether there is thrombosis, how the bowel habit is, and whether the person has other health issues like diabetes, pregnancy, or hypertension. For some people, the best treatment is fiber and water. For some, it is banding. For some, it is surgery. And for many, the best results come from combining symptom treatment with long-term lifestyle correction. If you are listening to this and wondering what to do next, here is a very simple checklist. Ask yourself, am I constipated? Am I straining? Am I eating enough fiber? Am I drinking enough water? Am I sitting too long on the toilet? Do I have repeated bleeding? Do I have severe pain? Do I have a lump that came suddenly? Do I have symptoms that keep returning? The answers to those questions often tell you whether you need simple self-care or proper medical assessment. And finally, please remember this. A hemorrhoid can be common, but persistent rectal bleeding should never be brushed aside casually. It is always better to get checked than to assume. That brings us to the end of this complete hemorrhoids guide. Now you know what hemorrhoids are, why they happen, how internal and external hemorrhoids differ, what the symptoms are, when symptoms become dangerous, how doctors diagnose and grade them, what to eat, what to avoid, which home treatments actually help, what medicines are used, what office procedures exist, when surgery becomes necessary, and how diabetes and high blood pressure matter in treatment planning. If this video helped you understand piles clearly from start to finish, subscribe to our channel for more videos. Thank you.